expand my living room. It's no imposition. If I could, I would give them the moon. There's nothing I wouldn't do for my cats. Cats, 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 cats. I love plenty of cats. Big ones and small ones, short ones and tall ones. They all make me laugh. Cats, cats, cats.
Hello, you're on the Healthy Pet Show. I'm Dr. Paige Wages, and tonight we have Dr. Colleen Sawyer with us. And I just wanted to remind you, if you have any questions about your pets at home, we'd be happy to try and answer any questions you have. The number to call is 996-6775. Again, the number is 996-6775. So don't hesitate to pick up the phone and give us a call. And Dr. Sawyer brought one of her friends with her tonight, so we're gonna start off the show with a little introduction.
I did, Dr. Wages. This is Lucille.
I'm going to take her out.
Come on, Lucille. Thank you.
This is your big debut.
Yes. Oh, there you go. Good girl. All right. Okay.
So tell us about Lucille.
Well, Lucille is approximately 1 year old. She's a female spayed cat that she was found wandering in a parking lot in Raleigh somewhere a few weeks ago, right around Christmas time actually. So she is looking for her forever home. If you have room for another cat, make room in your house and your heart for Lucille. She's a totally sweet cat and she would make a great addition to any family.
Is she good with other kitty cats?
She is. She's good with other cats. Has not been tried out with dogs yet, but she has a really even temperament and she'd make a great pet. So she is at our Oberlin facility, which is at the corner of Oberlin and Wade Avenue, and she's up to date on vaccines. And if you're interested, please call the number or call the Oberlin office at 832-3107.
Oh, she's super sweet.
Mm-hmm.
Dr. Sawyer loves kitty cats.
Oh, yes.
So tonight we're actually going to talk more about cats.
Yay! All right, Lucille.
And their little skin things.
Yes.
All right.
All right.
Right here, I'll
Great.
hold her.
Okay.
Come here, Lucille. She's really sweet. So if anybody needs a little kitty cat, she's real nice.
Mm-hmm.
So we've had a lot of, I actually asked one of my clients the other day about what they wanted, what they'd like to learn about on the Healthy Pet Show, and they mentioned that nobody ever talks about cat skin stuff, and their cat was in for having a very itchy skin, itchy back, and had pulled, kept finding, it was a black cat, so they kept finding tufts of hair around the house, and was wondering what was going on. So anyway, so that's how, so came in and we took a peek at the skin and found a couple little pink bumps, has a flea allergy, come to find out, so it was a little bit of a flea allergy reaction. So we gave some antibiotics and should be good to go, and some flea prevention. We actually didn't see a flea because they had already reapplied the prevention. But that was just one of many diseases that could affect the cat's skin. What else?
Well, I actually have a question about flea allergies, if you could clarify that. So how is a flea allergy, a pet with a flea allergy somewhat different from a pet that does not have a flea allergy? What's the difference?
So I think, the biggest difference in just talking to people, personally my own animals, one of my dogs actually has a bad flea allergy. But you can have, like Lucille could be covered in fleas and you wouldn't notice because she doesn't really care. But if they have an allergy to the flea, so one flea running across the back could create an allergic response and the whole skin gets really, really itchy. And the flea's favorite spot is around the neck and around the butt, around the tail area. So they'll be licking and chewing and licking and chewing, sort of like, looks like they're trying to eat corn cob is the way they chew because it's very itchy. So I think that's the biggest difference. Do you have any?
I've noticed that too, even we don't even find fleas and maybe just one flea had bitten them and they're very itchy still because of the flea saliva. And so you just have to do really strict flea control of the house, the yard, if they go outdoors, and for the actual pet too. So.
Yep, that's true. So the flea bites, right? It creates an allergic reaction, which is a histamine release, I'm assuming. So it works pretty much the same way. Like if you're allergic to bees and you got stung by a bee, if you don't get that much swelling, that you would with a flea, but it's something, in terms of the itchiness, it's something very similar. So just to put it in person perspective a little bit. So what else, what other kind of allergic reactions and things do we see in kitty cats?
Sometimes we see a sensitivity to like mosquito bites. They get sensitivities around their ears and can be really itchy.
What does that look like?
They can get scabs all around their head and their ears and can be pretty itchy with that. Yeah. So Lucille has lovely black ears here. She doesn't have this problem, but if say she did, and she went outside, the hair falls off, and the ears look really scabby and knobbly. So that's that would be another one that's true. So let's talk about some like things that we have pictures of, because I think that would help to explain and show some of the skin diseases that we have going on.
That sounds good.
So we have some pictures in this book, and we might need a close-up of some of these pictures.
Don't name the book. And just a reminder that if you do have a question about your pet at home, whether it's about your cat's skin or anything at all, don't hesitate to call. The number is 996-6775.
Okay. So
all right. What kind of pictures do you have there, Dr.
All
Sawyer?
right. We have all sorts of fun pictures. So this picture right here, I'm not sure if you'll be able to zoom in on this particular picture.
There you go.
If you can see that. Okay, perfect. That looks great. So this was taken on a cat's skin, and you notice that, what do you notice about that picture, Dr. Wages, if you were describing it to a client?
It looks like the hair kind of fell out in the middle, and the skin's a little bit red and irritated underneath.
Yeah.
But the skin around it looks normal.
Right, right. So in the clinic, sometimes if we see something like this, we might try to pick at the hair around the edges of the circle, and the hair tends to fall out very easily with this. So, and sometimes if we take a black light and turn out the light, sometimes this may fluoresce green. So this actually is a fungal infection known as ringworm.
Oh.
Yeah.
And in a cat, is ringworm is that contagious to people?
It can be, absolutely, yeah. So if your pet has fungal disease, particularly cats, we see it more so where it can be contagious to humans. So if you have a cat with fungal disease and you see red circular, I want to say lesions, but they basically red circular abnormalities that show up on your skin, make sure to see your doctor because it can be contagious to humans.
And it's very itchy.
Yeah, it's itchy and it's treatable though, so that's the good thing. So also very contagious to other cats. So we see this a lot more with kittens that are housed in a group housing situation or shelters. So especially since kittens' immune systems are not as good as an adult per se, so we see it more so in kittens. And it becomes a problem because it is contagious easily to other cats and kittens. So it's very important to contain and isolate that animal. And often they require treatments anywhere from 2 to 6 weeks, depending on how well they respond to treatment.
How bad it is, yeah.
Yeah.
And not all forms of ringworm are contagious to people. So just keep that in mind. So if your cat or dog is diagnosed with a ringworm or a fungal infection, don't panic. There's only one form that's actually contagious. So it is rare, but it's possible.
Yes. Okay.
What else you got in that book there?
All right. So we have our next picture here. This is our...
We try to take pictures of cases that we see.
Yes.
So that it's easier.
use them for teaching. So it's mainly this one on this side that we'd like you to zoom in on if you can.
It's coming. There it is.
Okay. So this is a cat's skin. You can see all the hair around it, and then it has kind of these things sticking out here. And Dr. Wages, you actually saw this patient. How did this look in the exam room?
Actually, they're like little horns that come off the skin. It looks like little nails that are growing off the skin.
Like this is upside down. Looks like this is the cat's mouth up here.
Yeah, it was down her neck, it was on her legs, and then she had the one on the right there is a red lesion. She had one of those, but a bunch of these little horn things, and if you pull them off, they grew back. So we actually biopsied them, and it came.
And what does biopsy mean?
Biopsy is you take a piece of one or a whole thing and send it off for a pathologist to look at. And the pathologist will tell us exactly what's going on with the skin or whatever we're biopsying, what kind of changes microscopically they're seeing, inside, like a cellular level. And with this cat, it was called Bowen's disease, which is actually a form of cancer, or lymphosarcoma of the skin. It's a pretty aggressive cancer, and the cat did well for a while on a short course of steroids, but eventually became very ill.
Right.
But it was an interesting presentation, because a lot of times you will see one or two of these little horn things, and it's extra calcification or it's basically overgrowth of nail material, which isn't usually a problem, but when you have a ton of it everywhere, then apparently it becomes into some sort of cancer.
Great, thanks for sharing that. So, and just kind of a general announcement, when we say lesion, because we use that all the time, and I remember in vet school I didn't know what that meant until they taught it to me in pathology, but it's anything abnormal that we're describing. So that's what we mean when we say lesion. So then we have this next picture here, and this is of a cat's foot here, looks like.
Yeah.
Yeah, okay.
Here's another one of that one.
Great. Oh, this is a good picture too. So there's another picture here. Thanks. Okay. Great. Okay. So you can see this picture, and then there's one also right next to it that we can look at. And we're looking at the pads of the cat's foot. And Dr. Wages, what did you notice when you investigated this cat's foot? What was different about the paw pads?
Well, this kitty cat came in sort of painful walking. Didn't really want to walk around, and the pads themselves were red, inflamed, and soft. They were really soft, but painful to touch. And then he's got a little bit of hair loss around his ears as well, kind of on the bottom, you can see that. And it was a little bit scabby all the way around.
Okay. I have also seen some patients that have this particular disease, and they also tend to have around the nail bed some like crusty toe jam around the nail bed
that picture right there shows that.
Yeah.
Yep.
So that's another characteristic. They don't necessarily need to have it to have this disease, but I do have another picture to show of this particular disease on a cat's face, and
So it could be anywhere, sounds like.
Yeah. So this is one of my patients. This is Tigger, one of my favorite kitties, and as you can see, he had a lot of hair missing, and his skin was really pink, and he has some crust lesions up here. And he actually, I took biopsies of a few places on his skin, and the diagnosis was pemphigus. And did you happen to biopsy those cases?
Did.
And it came back as pemphigus as well?
That's correct.
Okay, and Tigger did not necessarily have the toe, I don't think he had the toe lesions, but it's not required to have pemphigus, but Tigger was particularly itchy on his face. Was your cat itchy that had the pemphigus?
No.
Do you remember? Yeah, okay.
No.
So he was itchy, but we have since controlled his disease really well. We originally used some cyclosporin with some prednisolone, and he's now just on the prednisolone, and I wish I had an after picture, but he looks great today. His hair's all grown back and he's not itchy anymore.
So you said the disease was pemphigus. Can you describe what that is?
Yeah. So pemphigus is basically an autoimmune disease of the skin where your immune system kind of attacks the normal construction of the skin, and it causes those erosions and ulcers to develop. So
Interesting. So it's a body's reaction against itself, right?
kind of, yeah.
Yeah. And you mentioned that you were using cyclosporin to treat it. Steroids are also something that can be used for that. Basically because that knocks, initially that's what usually started to knock back the immune response.
Right.
And what's the difference between cyclosporin and prednisone?
Well, cyclosporin is an immunosuppressive agent, a little bit stronger than prednisolone is the other one that we use with the kitties. But it works better in certain situations as opposed to the steroids. A lot of times you need steroids first to kind of get things under control until the cyclosporin kicks in. So,
And advantages of the cyclosporin?
well, you don't get the side effects that you do with the steroids, so that's why we like cyclosporin. It is a little expensive though, so sometimes it's cost prohibitive for certain people too. But the other thing to mention, sometimes when you have skin looking like this, to remember is to do antibiotics, because a lot of times there's a secondary infection, and if you don't treat with antibiotics, it won't improve as quickly.
Right.
So,
Good job with that one.
all right.
I think Tigger's also a diabetic, which complicated things a little bit.
I know, poor Tigger, but he's doing really well.
Oh, good.
So,
Good.
Yeah. Okay, we have a cool one here. You can see that one maybe. So this, let me orient you to the picture. This is the ear, and we're just holding the ear flap back, and then the head, the eyes, and the nose are this way. And then you can see all these little spots here. What are those, Dr. Wages?
Those are freckles.
They're like
Those are freckles. So this kitty cat is a black cat who loves to sit in the window. Likes to sunbathe a lot. So he was sitting in the window, and the owner just noticed the spots, which he was concerned they were bugs, just appeared, and they're actually freckles, which are sunspots. So we'll just have to watch them. They're flat. If they raisin, then we get worried, or raisin, is that a word? If they get taller, then we get worried about melanoma or something like that, but not a worry. It's completely normal and not uncommon to see in black cats, especially around their ears, which is normally white. So
Great.
that was a fun one.
We have another picture here. This is another black cat.
There it is.
Perfect. And this is the top of the head. You can see how there's hair missing here, and also hair missing here and here. So when you see a cat like this come into the clinic, what's one of the things that you like to do for a diagnostic
Well, it could be a
test?
lot of things as a problem.
Yeah.
I think kitty cats that lose hair around their ears. It could be a thyroid issue if their thyroid's off. It could be a parasite. They can get mites. It could be a fungal infection. Sometimes that's how ringworm actually will present on their ears. What else could possibly be?
Those are the major ones.
Those are probably the major ones. Yeah, this kitty cat we did a skin scrape on, and it actually had mites, which is really rare. In cats. Mites or mange is more common in dogs, but this was the cat form. It's called Demodex cati.
Yes.
Versus the regular Demodex in dogs. But this cat was treated with dips, was the only way really to get rid of it. He was itchy. He was very itchy to start.
Did you try ivermectin with him?
We did not.
You
We did
did
not.
the dips, and he responded well to that.
Correct.
Okay.
Yeah.
Great.
But he was a really nice cat. So the interesting part is that a lot of cats will present that way with a little bit of hair loss around their ears, and it is a little tricky to sort of figure out exactly what's going on. And routine blood work and things like that will help rule out thyroid disease and other things that could cause that. So.
Well, this is somewhat of a related picture, and if you could please focus on this one in the top right corner. This is the Small Animal Dermatology textbook. And we see this a lot in black cats. It's basically, you notice like from the eye to the ear, it seems like their hair is kind of thinning there, right? And I actually had a client come in last week because she wanted me to check that out. But just like you mentioned, when we have hair loss in that area, some of the major things to rule out would be fungal disease or mites. And if those are negative, this actually can be a normal variation, especially for black cats or short-haired cats. And it's just called pre-auricular alopecia, which just means hair thinning before the ear. That's all that means. And I thought that was interesting that this was in a dermatology textbook, because I've noticed it with my black cats at home, and I just never really thought about it, but they actually have a diagnosis for that.
Yeah,
so
it is good to rule out medical causes of it. I have seen kitty cats get that with thyroid disease, so if their thyroid levels are starting to get up or down. And I've also seen it as a reaction to medication. So sometimes if they're on a medication, that could actually cause hair loss around the ears. Usually they get itchy, so they'll be rubbing, which is why the hair falls out. But it is interesting that it can actually be truly normal, and it's mostly just in black cats. So that is a fun one.
Okay, so this one, this is a picture of a cat, and you can see
That's a cat belly.
it's a cat belly.
To orient you a little bit.
So looking at this picture, we see what looks like just some crusting material there. Was there any pus or anything coming out of these holes?
There was not. This
Okay.
cat presented for being lethargic, not wanting to eat, had a high fever, and had these little kind of spots on the skin, but there was underneath, it felt a little bit fluidy. underneath those
Okay.
areas. Okay. So that's how he came in.
Okay, so then what did you do next to try to figure out what was that fluid and going?
Yeah,
stuff
so
going
we aspirated it, which is where you place a needle in there and pull off some of the fluid, and it was an abscess, which is very common in cats. It was a bite wound. So this cat was bitten by something. It very commonly will be a cat or a dog or a raccoon or something, but wasn't sure with this one. Cats get abscesses under their skin because their skin closes really quickly. So it doesn't allow the bacteria to drain out. Instead, it kind of festers it. So they grow these pockets of pus under the skin. So this cat did have pretty significant abscess under there that was treated. And basically, we sedate them, drain that abscess, and place drains, which are these little plastic tubes to allow holes to stay open until it heals completely. So anyway, but usually with that, and some cats need drains, some don't, but a little bit of antibiotics and they're good to go. So, but that is one of the more common things that we see from outdoor cats that come in. And usually they present with not eating well, and that's because of the fever. So.
Okay, I'll show that one.
Yeah.
Okay, here's another picture.
I think it's good.
Yeah. Okay, so you can see this is the nose and the two eyes. And this, we noticed that there's hair loss and looks like crusts, meaning like scabs, all along here. And was there any pus or blood here? Was the cat itchy at all?
She was a little itchy in the beginning.
Okay.
The owners had noticed that her skin was a little bit crusty. She had other spots that looked like this down her back. And this is very, very, very common in white cats, especially white cats that go outside and are exposed to the sun. This is actually squamous cell carcinoma, so it is a cancer, and if people get this on their skin, it's a skin cancer. And it spread pretty quickly with her to where she became uncomfortable, but she did do well for a while. And it did take several years to become a major problem for her. But it usually presents as scabs. So if your cat has scabs that are not healing, it would be good to bring them into your veterinarian to have them looked at. So.
We also have this picture.
Oh yeah.
Okay, and this is obviously the nose and the mouth, and then we see kind of this mass or growth
Bump
right here, or bump. Exactly. Did this cat have any symptoms associated with this mass?
No.
And the owner just noticed it and brought him in? Okay. And so what did you do next, and what did you find out?
So this cat, I think when we looked at the cat, the mouth, part of the jaw was actually affected. On the bottom jaw was pretty uncomfortable when I opened the mouth. So we sedated and took a little biopsy of it to see what it was. And this one was also squamous cell carcinoma. So it was the same cancer, but in the mouth, which is the more common place to see in a cat, is they get it in the bone of the jaw. And a lot of times we'll see it where a tooth suddenly falls out, and then the jaw swells after. So.
Yeah, so obviously if you ever notice any weird swellings or masses around the cat's mouth, certainly bring that in, because and let's get a look at it, because that can be a concern.
Yeah.
Certainly. So, okay, great. Let's see what else we got here.
That's another squamous cell.
Oh, okay.
Do you have, what's one of the most common ones that we see? Where they come in and they either have a really big lip, they'll get one part of their lip gets really big, or they have like a little red kind of spot where the hair disappears.
Are you thinking of
on
this?
the neck? Yes.
Okay, so we have another picture here. It's mainly these two pictures down here to focus on. This is from the dermatology textbook. And you see this one, basically they have these red masses that usually are somewhat raised off the skin.
Or they're flat. They can be
They
flat.
can be flat. That's very true. Do you notice that cats are bothered by these?
They usually are licking them.
Right. Yeah, they're licking them a lot. Very true. Very true. So, what is your next diagnostic step if you see something like this?
Personally?
Yeah.
Oh, I just treat them.
Okay. Well, one time when I was kind of new veterinarian, I said, well, this looks very suspicious of eosinophilic granuloma complex. So I took a needle and stuck it into that mass, and then I squirted the needle onto a slide and looked at it under the microscope, and I saw tons of eosinophils.
Oh,
There you go. So, but this is an eosinophilic plaque or eosinophilic granuloma, and usually responds very well to steroids and can certainly come back and go away and come back. So it can be frustrating to manage that.
Right, and eosinophils are a white blood cell that responds to allergies. So this guy, and sometimes they're actually, they'll get them in response to an allergy to food. One of my friend's cat would get one on her face every time she ate the dog's food, which was chicken. Her food was fish. So
yeah,
that is something to be aware of, that sometimes you need to remove the food. So anyway, we need to close very soon, but I just wanted to remind everybody about Lucille. She's desperately looking for a home, and she's really sweet. She's been sitting on my lap purring the whole show.
She's such a good cat.
She's a good cat. And I wanted to thank Dr. Sawyer for coming out and sharing her expertise
You're
with
welcome.
cat skin diseases.
It was a lot of fun
tonight. And we look forward to seeing you next time here on the Healthy Pet Show.
So great.
I love plenty of cats. Big ones and small ones, short ones and tall ones, they all make me laugh. Cats, 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 they're all I adore. Though I've got a million, I'd make it a trillion, there's always room for more. Cats, 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 how I love a crowd. Skinny and fat ones, orange and black ones, love the sound of meow. Cats, 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 just knock on my door. I'd never turn one away, not tomorrow, today. There's always room for more. I'll build an addition, expand my living room. It's no imposition. If I could